One of the most important assessments in non-weight bearing for the UFIR is in side lying, and you're going to assess the joint play of the femur relative to the acetabulum. So you'll stabilize right now with my left hand on the pelvis, on the ilium, and we're going to assess the ability for the femoral head to move that little bit of accessory motion in the joint. With a positive, you'll get no motion in a hard end feel. So that brings us to the actual manipulation. So what we're going to do here is I'm going to have my finger on the back side of the greater trochanter, and you want to explain to the patient what's going on before you do it. I'm going to use my hand like this, and I'm going to give a percussion right where my thumb is. It's going to feel something like this, okay? And we're going to do that 3 times. So again, with your fingers, you're going to stabilize the ilium, and then you're going to get on the posterior aspect of the greater trochanter with your thumb. You're going to use a cupped hand, and you're going to come making contact with your thenar portion of your hand and letting momentum take the rest of your hand over anteriorly. And what we're doing here is trying to create a glide and a repositioning of the femur to center the axis of rotation in the acetabulum. So, ready? So, we're biasing for internal rotation here. So, after that first one, we may bias a little more internal rotation and repeat the same process. Stabilizing the ilium, thumb on the posterior aspect of the greater trochanter. And depending on how it feels, we may even go further into this bias. And that is the UFIR manipulation.